It is one of the biggest myths that if you have to crack this exam, you have to study for 10 hours, 12 hours. I think it's a good idea to start with MCQs. A very important part of MPhil is preparing for the interview. Right. The interview can be very scary because for many people this is the first time where there is a panel and they're throwing questions at you.
One of the problems that I see with students is you appear for one exam, you are not able to clear it. 1 month later you appear for next exam, for some reason you could not clear it. It becomes very difficult to persevere. I mean, these repeated failures, if I may say so, kind of saps out the energy. So what should be the approach of a student? How to handle these failures? So what kind of a change happens when you enter MPhil?
That's a very, very big change because you're not just a student.
Right.
You're a professional.
Exactly.
In the hospital setting, it is very easy to get subsumed by that view. To lose your voice. The life as you know it is going to change completely.
Right. Hello everyone, this is Dr. Praveen Tripathi, faculty at Conceptual Psychology, and with me is Miss Anandeshwari, who is also faculty at Conceptual Psychology, and she also got rank 1 in the MPhil entrance examination for IHBAS in 2019.
Yes.
Right? So I entered IHBAS in 2011 and you entered in 2019. So both of us are the alumni of the same place. So in this video, Anandeshwari, basically I want to talk about how you approach that exam. Because IHBAS is considered as one of the toughest entrance examination and you got rank 1. So how you approach that examination, what went into the preparation, and certain other things that students usually talk about.
Yes. So thank you, Dr. Praveen. I think for my examination, my approach, the first thing that was important and that I think is important to highlight here is that I had given that exam while I was doing my MA once, right? And my purpose in giving that exam was to know the exam pattern, right? That what are these different universities asking, right? So I had a fair idea about if I'm preparing for, say, KGMU, what should I be stressing at? If I'm preparing for IBHAS, what is more likely to come, right? So the different colleges had different patterns, different fortes. So you have to focus on that. I was focusing there. Then during my 1 year that I took a gap, I was also teaching and I was working with children simultaneously. So I actually had 2 jobs there. And it is one of the biggest myths that if you have to crack this exam, you have to study for 10 hours, 12 hours. I don't think that's true. None of my batchmates studied for 10 hours, 12 hours. It requires good strategy. So my strategy was I moved from, because by the time you're giving MPhil, you've already done your MA, your base is clear. You already know what is there to know, right? So going back and studying those books would serve little purpose if you're doing it in the air, right? If you're preparing it like you're preparing for a college exam,
right?
Because exam mein MCQs aayenge, right? So I think it's a good idea to start with MCQs. So my approach was I would take a question. For example, if the question is who gave classical conditioning? And the option is Pavlov, Skinner, Watson, Freud. I did not stop at just solving कि अच्छा हाँ Pavlov ने दिया था. I found out what did the other 3 give. Right, so I researched about operants. So that way, one question gave me 4 theories.
Right.
And if you see, then that is I researched that. I made a document. And I studied like that. So that way you're solving questions. You're also trying to see, अच्छा इसके आसपास ज़्यादा है. This topic is coming more. This topic is weak. Maybe questions. This is how the questions will be asked from this topic.
Right.
So that was my strategy.
Yeah. So sometimes we use the term retro approach for this kind of strategy, where you start with the questions and then all the options, the explanation of all the options you go through. And as Anandeshwari very rightly said that every question is kind of helping you prepare 4 topics.
Yes.
But ma'am, another question that I have is, and I see this more so in the way MPhil entrance examinations have been cycled. Every 2-3 months you have an exam. Like in our case in medical, we have one NEET PG exam, 2 INICT exam. So students prepare for an entire year, they know this is when the examination will happen. Here what I see is examinations are happening every 3 months. So you're never getting a good 6-7 months at a stretch. So how much of an impediment was this fact that the exams are spread out across the year?
The primary thing is that it's more of a psychological impediment because you are giving an exam. If you don't get through, you feel a little let down. But the trick is to not let it bother you. Like I had a very simple formula that, you know, there are people who are getting it. जो जिनका हो रहा है वो भी इंसान ही है. They're not some, right?
Not from another planet.
Yeah. So that was there. And the second thing is that the pattern, if you analyze the pattern of the test, that's why it's very important to analyze that which institution is preferring what. For example, at my time, I realized that KGMU was giving more emphasis on biology, biopsychiatry, what we call, right? So you prepare that, okay, this is what I need to have more emphasis on, right? IBHAS is a overall kind of a paper, but they do have questions like who wrote this book, which year did they write?
A lot of factual information.
That kind of factual information. They also have application based, but that is the kind of thing. Even say PGI, all of that have more research based.
NIMHANS is very clinical. I was going through the NIMHANS paper, very clinical. Yeah.
Yes, NIMHANS again, and also NIMHANS में negative marking.
Okay.
So you have to know all of that. You have to know the paper. You already know the subject. You've done your masters. You already know the subject. You have to know the paper.
Right. So what you are suggesting here is that the basic framework may remain the same, but then you have to see what paper are you going to appear for and what that paper is stressing upon. I mean, I was looking at NIMHANS paper, very heavy on abnormal psychology. But then there are certain papers in which it's more of research, more of and then the whole idea that some papers are asking a lot of factual question, who gave this. And personally, I really hate those questions. I mean, why do we have to remember it? But it is what it is. All right. So, Anandeshwari is still very intrigued by the fact that you were doing 2 jobs and preparing for an entrance examination, and then you got rank 1. So, things don't add up. I mean,
I think it was okay. A part of
maybe
it
we need to get your IQ tested.
I think a part of it is luck. But a part of it is also, I knew what the paper is. I had spoken to people who had appeared. So I had spoken to I knew what their emphasis is. And a very important part of MPhil is preparing for the interview. Right. The interview can be very scary because for many people, this is the first time where there is a panel and they're throwing questions at you. Right, so I remember my interview started with, do you know what is the origin of salary? Right?
Salary, okay. Wow.
What is the origin of salary? And I was a little bit taken aback. And then they told me, nahi, वो salt से salary आया and all of that. And पहले salt देते थे, फिर salary आया. Well, that's okay. Now, one important trick for interview is to have your expertise. They know that you don't know everything. Right? They know that even they as professors in that place, even they won't know everything. They'll have their own area of expertise. So you can guide the interview towards that. Right? You're here to learn. You show that you're eager to learn.
Right.
And that's about it for the interview. I think that you have to prepare. And of course, there is luck.
Yeah. Anandeshwari, when it comes to MCQs and practice of MCQs, I think, I mean, it's been almost 5-6 years since you appeared for the examination. Things have changed a lot. So what was your approach? Would you go chapter-wise or would you try to do a lot of mock tests with all the topics together?
Right.
And then what would you suggest the juniors? How should they approach it?
I think I would... you get a lot of these papers, books with MCQs there. So going chapter-wise would probably become tedious, you may lose interest. And sometimes you may be learning things that are not necessary. Right. So you have limited mental space. You focus on what you think is necessary. if you take that approach, if you go from the question to the theory, you are automatically seeing that what are the questions that are getting repeated. And as the questions are getting repeated every year, if you solve a lot of these papers, you will realize, okay, these are the important parts. And maybe then you can go back and see it more in detail and all of that. So that was my approach. I was not doing theory heavy reading at that time.
So students, I mean, in that the same context, now in Conceptual Psychology app, and I would give a lot of credit to Dr. Avni ma'am, who is heading this entire project. She has worked very hard and created a very good Q bank. The Q bank carries the exact same thing. You'll have questions, you'll have 4 options. When you click an answer to click one of the options, you will see the answer, the explanation for all the options. So it works exactly the way ma'am has been saying. Now it's much more easier because it's all tech driven, and it feels much better that you are clicking next and the next thing is coming. Another thing that Dr. Avni has done is she created a lot of mock tests. For IHBAS a different mock test, for RML a different mock test.
That's very
and yeah, for IHBAS a different mock test, and some of those tests have video explanations also. So I think it would also help the students a lot. Anandeshwari, if I ask you, what is the ideal time frame that should be allocated to the preparation? And if I may say, there should be at least 2 phases. One when you study as a routine, and then when you accelerate. So what is the duration, optimal duration that would be required to crack an exam?
So I think as your exam is approaching, even agar 2-3 mahine mein hai, you should leave time for revision. That's very important. And revision is basically you go over your questions, you go over points that you've marked as important. I think with Dr. Avni's efforts, it will be very easy because it will be tech driven. So there'll be, but
you can bookmark and all.
Bookmark and all, So that way you'll know what are the points important and you go through that.
Right.
Especially in exams where you have factual data, you go and learn that ये book का नाम ये है, year ये है, author ये है. Right, for your formula, stats, you go through that. Otherwise, you can have your preparation phase in your normal preparation phase can be 1.5-2 months. And then you can have 20 days of accelerated kind of very thorough preparation where you're going through everything, seeing that your bases are covered. And then you can have 10 days of just looking at questions and answers. Do I know the exam that I'm going to appear for? What is the focus of the exam? Do I know that well? So that is...
So if we talk about the different components or different subjects, like we have abnormal psychology, we have stats, we have research, we have biology. So which subject the students struggle with the most?
I think stats.
Stats, okay.
Stats, I think they really struggle with because it's technical, it has maths का वैसे भी phobia होता है. So all of that, I think that is research methods and stats.
Yeah, makes sense.
Yeah.
One question, Anandeshwari, not only as a teacher, but also as a psychologist. I mean, even if we are psychiatrists and psychologists, we still have the same emotions, same disappointments in life. One of the problems that I see with students is you appear for one exam, you are not able to clear it. 1 month later, you appear for next exam. For some reason, you could not clear it. It becomes very difficult to persevere. I mean, these repeated failures, if I may say so, kind of saps out the energy. So what should be the approach of a student? How to handle these failures?
To remember that you can control it to only a certain extent. And it's not a personal failure. It's not reflective of your knowledge as a professional. It is reflective of your knowledge of what the paper asked at that time.
Right.
So to not think of these exams, so MPhil mein the problem is, as you were rightly pointing out, there is no end goal. You don't know ki acha, this is the exam that I'm going to give.
Right.
So to not fatigue yourself, to take studying as routine. You live your life, you study also.
Yeah.
If you just have that kind of I'm going to do this and I'm going to fatigue myself, then by the time your second, third exam comes, you are experiencing fatigue, burnout. So just take it as a part of your life. That अभी ये इतना करना है जब तक नहीं हो जाता है. So that's.
Also, it may be a bit of blessing in disguise. Like if you have one day in an entire year, the pressure is so much that everything should go right on that day. Here you can say, okay, if I make a mistake 3 months later, I'm going to have another exam. So I mean, that, you can spin off. You can spin the thoughts in a way that suits you. All right. Anandeshwari, another thing. So I mean, exam is one thing. Once you get into MPhil, once you start your studies, it's a different world altogether. From academics to patients, from books to making diagnosis and treatment. So what kind of a change happens when you enter MPhil?
That's a very, very big change because you're not just a student.
Right.
You're a professional.
Exactly.
You're dealing with patients and they're trusting you and they don't care if you're a student or whatever. They have contact time with you. You have to give them your best.
Right.
And till MA, you have a little bit of, you know the routine. You know, अच्छा ये करना है, college जाना है, ये पढ़ना है, ये exam देना है. Here you have to learn every day. So in MPhil, I think your emotion, your resilience, your ability to tell yourself that, again, my same formula, कि इंसान ही पास करते हैं ये course, right? Sometimes it helps to know that there were people before me, there'll be people after me. It's not undoable. So to have that kind of resilience, to have a little stable mindset and to know your routine. To know that this is what I have to do. If you think about how can I escape this, then you will feel that, because there is no way of escaping it. Somebody will catch you and you should not be escaping because you're actually dealing with people. So just MPhil, actually entering MPhil requires more mental resilience than preparations. Preparations, you're used to studying, you're used to that. But MPhil
so that's my next question, that at least in IHBAS, MPhil is a very intensive course, right? You have classes and then you have to go to wards and then you are doing testing and you're going to OPD and it's exhausting. I've seen, I mean, my fellow, the colleagues with whom I was training, it was not easy at all. So a student who is preparing for MPhil, what can he or she expect? I mean, how difficult it is going to be, and should they enter with certain notions in their head? Like I'll just give you an analogy. Like when a person goes into MD, they know that for at least the first year they're not going to have any personal life, and I mean it doesn't help completely, but at least they know what is what to expect. So what is the same thing as far as MPhil is concerned?
I think know that the life as you know it is going to change completely.
Right.
You are going to be occupied from 8 o'clock in the morning to 8 o'clock in the evening, and then you will be expected to come home, study and be prepared for the next day. That is your life,
right.
And that is how it should be, because it is not something that...
Are you a Narayan Murthy fan? 12 hours a day.
No, that is how it should be, because there is resource crunch, there is all of that, and you have to be responsible for that. So that's okay, but there will be, but ऐसा भी नहीं है कि बिल्कुल ही you are. We've had, I think, some of the most fun times that I've had is going to be was in IBHAS, because you're in hostels and you have friends, and we used to also have a lot of fun, but it is tough. I mean, compared to your MA or BA, it is one of the toughest things that you're going to be doing.
Were you in hostel too? I mean, the one with the junior residents and
yeah.
We used to be in hostel.
Yes.
So let me ask you this. What were the good times that you spent in IHBAS?
Oh my God, that was, I've also had a lot of good times. So we would have parties, and every birthday we would celebrate on the terrace, and we would, all the entire batch, my batch was brilliant. We were friends, and we would get together and we would dance and we would have fun. Even we would do a little bit of like, play around, play pranks with the seniors, with juniors, अच्छा अभी 7 बजे की class है, तो there'll be one person who'll be in charge of waking everybody up. So then that person is coming, waking, and उसको गाली भी पड़ रही है. So all of that is also happening. So it's actually a life in its own, and the IBHAS campus is beautiful. So you get to have that.
And sometimes scary also. How was your interaction with the psychiatry residents and the psychiatry senior residents?
See,
You don't look happy.
No. The frame of reference is different. Our world, we are doing the same thing. We're just approaching it from different angles.
Right.
So, I mean, I say this with all respect, but in the hospital setting, it is very easy to get subsumed by that view. To lose your voice. So I think if you are confident in what I am bringing to the table is also important.
Extremely important.
So that I think it's difficult as a new student in MPhil. With time you realize ki nahi, this is there, but it's very easy, to put it very simply. I mean, you're in, you know it. It's very easy to get lost in the grand rounds.
Right.
Right. वो आवाज थोड़ी सी दब जाती है.
To be fair, everybody is lost in the grand rounds.
But yeah, that I think that you.
I think for both psychiatry residents and the psychology students, it is very important that the seniors tell them that finally it's a team which is going to work and which is going to deliver results. I mean, I have been practicing since 2015 and I got a chance to work with Dr. Avni, Snehanki. We could not work much together because I shifted into these things. And then even Ms. Nishtha is there. My viewpoint after 10 years in practice is that psychologists play a huge role. And I always tell psychiatry residents that when you enter first year, if you want to take one advice from me, it is respect psychologists and learn from them. Don't ever think that just because you are an MBBS doctor, you are in any way superior. Because finally, what matters is whether the patient is getting better or not. And there have been so many times when as a clinician, I was lost and I relied on the expertise of either Snehanki or Avni for results. And I don't have any problem in accepting that because that is how it is. If a person is coming with, say, some kind of crisis, if a patient who has borderline personality is coming to me, my medications can have very little impact in comparison to what a therapy session can do. The vice versa is also true. Say a patient comes in full-fledged psychosis, I mean, therapy would not be of much interest. But this one-upmanship that I am better, you are better, which is unfortunately very prevalent, this is very unfortunate. So I hope professionals and seniors from both the branches tell this to juniors that, it's a team which matters.
Exactly. It's not a competition.
And I mean, think about it, maybe 90% of the patients are being seen by the quacks and people who have no degree. Why you guys are fighting with each other? Fight with outsiders. Anyways, so Anandeshwari, coming back to the academic part, so say a student wants to start preparation and she or he is lost. So what is the first step? A broad framework.
Okay, the first step is to tell yourself that it's not, you already know it. You're just going to be studying what you already know from different perspectives. Okay, so that kind of self-talk is necessary. Second is to start your MCQs.
Right.
See where you are. कहीं पे भी हम base rates तो establish करते ही हैं.
Right.
So you establish your base rate, see where you are, and then once you've solved your MCQs, you move in that approach, right? And you go back to it. You keep going back to it. See if it's getting better, if you're improving, right? And I think that's the approach that you should have. Start with the questions.
Right.
You already know, your base is there, you already know all of that.
Right.
Start with the questions and see where you are.
So that's a wonderful advice. Start with the MCQs, see where you stand, and then you take an informed decision that which subject you want to put more time into and which subject you are already good at. Now we have got rapid revision videos in the app already. Ma'am's videos are there, mine are there, Avni ma'am's are there, Olivia ma'am's are there. Use them. We had a lot of questions coming from the mock tests in the IHBAS and RML exam. They're very good mock tests. Use them and study hard. Finally, it all boils down to what kind of efforts you can put. And a very exciting, challenging but exciting life awaits you in the MPhil. All the best.